Hi everyone, my name is Kendall Lemons and I'm a second year student pharmacist at Cone Health. Today I will be sharing pharmacy updates for the month of March 2022. In this video, I will be talking about several new FDA drug approvals, including Adlarity, Nexiclon XR, Acuvue Theravision with Ketotifen, and Breyna. I will also discuss the draft of the KDIGO 2022 Clinical Practice Guideline for Diabetes Management and Chronic Kidney Disease that was released this month, and its implications for initiation of SGLT2 inhibitors. We'll talk briefly about the EMPA-KIDNEY trial, and then move to inpatient formulary updates from the March 2022 Cone Health Pharmacy and Therapeutics Committee meeting. Changes to the formulary included removing ivermectin and adding insulin glargine YFGN. Donepezil is an acetylcholinesterase inhibitor used to treat all severities of dementia of Alzheimer's disease. Until now, it has been available solely as an oral product named Aricept. With the approval of Adlarity this month, Donepezil will now be available as a transdermal delivery system. Adlarity is a once-weekly patch that will be available in two strengths. It can deliver either 5 milligrams or 10 milligrams of donepezil per day. A study comparing the Adlarity transdermal system to oral donepezil tablets showed that donepezil exposure from a once-weekly 10 milligram per day Adlarity patch was comparable to exposure from daily oral donepezil 10 milligram tablets. Adlarity should be used within 24 hours of removal from the refrigerator and applied to the back, upper buttocks, or upper outer thigh. Patients currently using oral donepezil 5 milligrams or 10 milligrams can be switched directly to Adlarity. The most common adverse reactions are listed here. The use of Adlarity can be a great option for patients who cannot take daily oral donepezil reliably due to impaired memory, or patients with diminished ability to swallow. Adlarity is effective, well tolerated, and comes with a lower risk of GI side effects than oral donepezil. It should be available in early fall of 2022. Nexiclon XR is an extended 24-hour release form of clonidine. It will be available in a 0.17 milligram or 0.26 milligram tablet and has been FDA approved for the indication of hypertension. Before the approval of Nexiclon XR, oral clonidine was only available as an immediate release formulation. As you can see here, the immediate release tablets require twice daily dosing, while Nexiclon XR can be dosed once daily. This table shows equivalent doses of clonidine immediate release and Nexiclon XR. Due to once daily dosing, Nexiclon XR could improve patient adherence. It should be up-titrated slowly for patients with renal impairment and should also be reduced gradually to avoid withdrawal symptoms. The most common adverse effects are dry mouth, drowsiness, and dizziness. Nexiclon XR is expected to be available in April of 2022. Acuvue Theravision with Ketotifen was also recently FDA approved. It is currently the only contact lens with an antihistamine built in to help relieve itchy eyes. Acuvue Theravision with Ketotifen contact lenses are disposable, single-use contacts that must be prescribed by an eye care professional. They start to work in about 3 minutes and last for up to 12 hours. They can continue to be worn after 12 hours for vision correction. The most common adverse reactions when using Acuvue Theravision with Ketotifen include eye irritation, eye pain, and installation site pain. Breyna is a generic version of Symbicort, an inhaler that includes both budesonide, which is an inhaled corticosteroid, and formoterol, a long-acting beta agonist. Like Symbicort, Breyna will come in the two strengths listed here and will require 2 actuations twice daily. Both Breyna and Symbicort are indicated for use in patients with asthma and chronic obstructive pulmonary disease. Breyna should be available sometime in 2022. To recap, here are the 4 new FDA drug approvals we have discussed, including Adlarity, Nexiclon XR, Acuvue Theravision with Ketotifen, and Breyna. Next, we will transition into a discussion regarding the updated draft of the KDIGO 2022 guideline for diabetes and chronic kidney disease. The guideline was just released this month and is still in the public review phase. According to the 2022 KDIGO draft update, SGLT2 inhibitors can now be initiated if a patient's eGFR is at least 20 milliliters per minute. This image is from the 2022 update and shows the new eGFR requirement for SGLT2 initiation. KDIGO's previous guidelines were released in 2020 and listed the eGFR cutoff at 30 milliliters per minute. This change was prompted by a new trial called IMPA-KIDNEY. The IMPA-KIDNEY trial has not been released to the public yet, so the information we currently have is limited. We know that the objective of the study was to determine if empagliflozin 10 milligrams daily reduces the risk of kidney disease progression or cardiovascular death in patients with CKD. The study included a total of 6,609 people, randomized from 8 countries, and is the largest trial for an SGLT2 inhibitor in CKD management to date. One important aspect of the trial was that they included patients with an eGFR down to 20 milliliters per minute. These patients have not been included in other studies for diabetes and CKD, and the results have prompted the KDIGO eGFR update. Researchers have recently announced that they are ending the trial early because the results have shown clear positive efficacy. The full results are expected to be released later this year. As we know, SGLT2 inhibitors exert their effect by inhibiting the sodium glucose cotransporter 2 and the proximal renal tubules, which reduces the reabsorption of filtered glucose and results in glucose excretion. The reason that there is a filtration requirement for these drugs is not because it will cause harm to the patient if eGFR is too low, but because the drug will not have an effect without glomerular filtration. According to the KDIGO update and the IMPA-KIDNEY results, SGLT2 inhibitors have continued efficacy at an eGFR of 20 milliliters per minute. This timeline shows how the eGFR requirement for initiation of an SGLT2 inhibitor has changed over the years. When SGLT2 inhibitors were first approved, they were not initiated in patients with an eGFR less than 45 to 60 milliliters per minute. In 2020, the eGFR requirement went down to 30 milliliters per minute, and with the results of the DAPA-CKD trial, it was decreased to 25 milliliters per minute. As we've just discussed, the eGFR requirement is now 20 milliliters per minute based on the draft of the 2022 KDIGO guideline released this month and the IMPA-KIDNEY trial. In conclusion, KDIGO draft updates and IMPA-KIDNEY results indicate that SGLT2 inhibitors can be initiated and show effectiveness with an eGFR of at least 20 milliliters per minute. At the March 2022 Pharmacy and Therapeutics Committee meeting, ivermectin was voted to be removed from the Cone Health formulary. This means that ivermectin will no longer be stocked in inpatient pharmacies, and patients who require ivermectin for treatment of parasitic disease will need to take a prescription to an outpatient pharmacy to be filled. I'm going to quickly review some background on biologics in order to support our next topic. A biologic is a medication or medical product that comes from a living organism such as an animal cell or microorganism like yeast or bacteria. A biosimilar is a biologic that is highly similar to and has no clinically meaningful differences from another biologic that is already FDA approved. It is important to note that a biosimilar is not exactly the same as the original biologic due to the complicated process of manufacturing medications from living organisms. When a biosimilar is designated as interchangeable, it has met additional requirements for FDA approval and may be substituted for the original biologic without an intervention from the prescriber. This process would be similar to substituting a generic drug for a brand name product. Designation of interchangeability is not common and only currently applies to 2 of the total 33 approved biosimilars. In 2017, the FDA made the decision to include a 4-letter distinguishing suffix in the name of all biologics, biosimilars, and interchangeable biosimilars. The letters attached to the end of the product's name are all lowercase and devoid of meaning. These suffixes were implemented in order to minimize inadvertent substitutions of products that are not interchangeable. Insulin glargine YFGN, brand name Semglee, is a biosimilar of insulin glargine that is considered interchangeable. Insulin glargine YFGN was actually the very first biologic given interchangeable status. In case you were wondering, the second and only other interchangeable biosimilar is adalimumab ADBM, which is a biosimilar of Humira and was approved a couple of months later than insulin glargine YFGN. This month, insulin glargine YFGN was approved for addition to the Cone Health formulary. Mylan Pharmaceuticals produces both a branded and non-branded version of insulin glargine YFGN. Semglee is intended for outpatients with commercial insurance, while the non-branded version is intended for hospital use. Non-branded insulin glargine YFGN costs significantly less than Semglee.